In this video, we will cover medical and dental plans offered by LACERS and topics such as eligibility, subsidies, and more. As we get started, it is important to mention that once you retire, LACERS administers your benefits. This is different than when you were an active employee and your benefits were administered by the personnel department. So that changes once you retire. LACERS Health Benefits Guide. Now let's mention our health benefits guide. One of the ways we familiarize you with our health benefits is through our health benefits guide. Think of this as your user's manual for your medical, dental, and vision benefits with LACERS. Once you are retired, this is mailed to you on a yearly basis. It covers any changes that are occurring with regards to medical, dental, and vision coverage for the plan year. If you ever misplace the guide, always know that a soft copy is available on our website, www.lacers.org. Health and dental plan enrollment eligibility. On to eligibility. Who exactly can enroll in a LACERS health plan? First, you, as a retired LACERS member. By the way, thank you for all you've done to make the city great. In addition to yourself, you can also enroll your eligible dependents. We'll discuss that more on the next slide. And even upon your death, an eligible survivor who receives a continuance or survivorship allowance is eligible. Eligible dependents. As mentioned, a deeper dive into what constitutes a dependent. They can be your legal spouse or domestic partner, children under age 26, unless they are eligible through their employer. A common question there is, do they need to be enrolled in college full-time? And the answer is no, that is not a requirement. Also covered are disabled children who become disabled prior to age 26 and grandchildren under age 26 if you are their legal guardian, have legal custody, or they are the child of one of your dependent children who you are covering on your plan. Something to note, your ex-spouse is not an eligible dependent. If you are unfortunately in a divorce proceeding and the topic of covering your ex-spouse is brought up, just know that you cannot add them to your LACERS plan. Health plan subsidies. Okay, let's get into the dollars and cents portion of this video. Health plan subsidies. How much does the city provide towards your medical and dental coverage? First, let's cover eligibility. Here are the requirements to be eligible for a subsidy. You must be at least age 55. You must be receiving a service or disability retirement from LACERS, have a minimum of 10 whole years of service, and you must be enrolled in a LACERS-sponsored medical plan or be a participant in the medical premium reimbursement program. One question that often comes up here is, what if I retire prior to 55? And the answer is, you are not eligible for a subsidy until you are 55. Another related question is, if I retire before 55, can I still enroll in a LACERS medical plan? And the answer is yes. You can participate, but you will pay the full monthly premium for the plan you choose. We'll discuss this on the next slide. Medical subsidy chart and eligibility. Retired members are eligible to receive 40% of the maximum medical subsidy with 10 years of service. For each additional whole year of service credit, members receive an additional 4%. With 25 years of service credit, they are eligible to receive 100% of the maximum medical subsidy. And the maximum medical subsidy currently is $1,790.80. That is the maximum amount. So if you choose a medical plan that costs more than that amount, then the amount over and above your subsidy will be deducted from your monthly retirement allowance. As mentioned previously, and you will notice on the chart, subsidies increase with each whole year of service credit up to 25 years. What does this mean for you? For instance, if you are nearing retirement and you have 23.99 years of service, you may consider working another pay period to reach 24 years of service credit and enjoy a higher subsidy amount. Dental subsidy eligibility. The dental subsidy also requires that you are at least age 55 and have a minimum of 10 whole years of service. But there is an important difference as noted on this slide. LACERS does not provide dental subsidies to dependents or eligible survivors. What does this mean? It means that if you choose to cover someone else on your dental plan, that premium will be deducted from your monthly retirement allowance. The maximum dental subsidies are listed here. And again, like your medical subsidy, it is based on whole years of service and maxes out with 25 years of service credit. Understanding your deductions. Your monthly LACERS health plan deductions, out-of-pocket costs, depend on the monthly premiums of the plans you choose, the number of dependents you enroll in your health plans, your and your dependents' Medicare status, and your LACERS subsidies. Different plans offer different benefits and have different costs. If you are just covering yourself in an HMO plan, that will cost less than covering yourself and a family member in a PPO plan. Your subsidy and plan offerings also change when you reach Medicare age. Also, Medicare is discussed in a separate video. Medical plan options. Let's move on to medical plans. As you see here, the good news is that in retirement, you can still enjoy providers who you are familiar with. Throughout your career with the city, you have probably used either Anthem or Kaiser. While on this subject, a common question we are asked is, does my plan offer the exact same coverage? And the answer is no. Your plan coverage is not the same because you'll have different needs in retirement than you did during your city career. You probably won't be bearing children, for example, and that usually gets a laugh or two. But in all seriousness, you can find out about the plan offerings by reviewing the Health Benefits Guide. If you have further questions after reviewing the Health Benefits Guide, please contact a member of LACERS Health Unit. Before we go to the next slide, you will see that towards the bottom of this slide, there are Medicare plans. Why is that? Because upon turning age 65, you must enroll in a LACERS senior medical plan. Again, Medicare is discussed in a separate video. Medical plans, where you live. Something that is important to take into consideration prior to retiring is that your medical plan offerings do depend on where you live. In other words, not all plans are available in all places. It is important that if you plan on residing in a different state, or a different country for that matter, that you review associated coverages available and accompanying premium costs. It goes with the saying, people don't plan to fail, they fail to plan. Let's go over this slide a bit more. As most LACERS retirees stay in California, California offers more available plans. But that doesn't mean that you can't choose to live elsewhere. In fact, you can live in many places throughout the world and have coverage through our Anthem PPO plan. What's important, again, is to review plan coverages and costs, as PPO plans are more expensive than our HMO offerings. Dental and vision plans. Let's also discuss dental and vision plans. The dental plan you can choose also depends on where you live. If you live in California or select areas of Nevada, think about, like the Las Vegas area, you can enroll in the HMO plan. If you live anywhere else in the world, you can enroll in the Delta Dental PPO plan. For vision coverage, that is determined by the medical plan you choose. If you have an Anthem, United Healthcare, or Scan medical plan, you will have Anthem Blue View Vision. Alternatively, if you are enrolled with Kaiser Permanente for your medical plan, then you will have vision through Kaiser as well. In all of these cases, there is no separate premium to pay for vision. It is already included in your medical plan premium. More on premium costs later. Health enrollment at retirement. Here's information on health enrollment upon retirement. Enrollment in a LACERS retiree health plan is not automatic. You may enroll in a LACERS health plan within 60 days of your retirement effective date, and coverage will begin on the first of the month following your retirement effective date. If you do not enroll in a LACERS health plan at the time of retirement, you may enroll during open enrollment or if you experience a qualifying event. There are many ways to reach us, whether you prefer to conduct your business in person by phone, via email, or just researching things for yourself, Lacers is here to serve you. There's even more to learn about your benefits. Watch other retirement topic videos on the official Lacers YouTube channel.